From 1990 to 2009, the pregnancy rates among adolescents, both nationally and Minnesota, dropped by over 30%. Fewer young people were having sexual intercourse, and of those who did have sex, more were using condoms and contraceptives. However, the 2010 Minnesota Student Survey showed a changed behavior. More students were having sex and fewer were using condoms. Was this just a single bump in the road toward fewer teen pregnancies, or did it mark a change in direction? It's too soon to tell, but it did highlight the fact that we need to continue to focus on the health and behaviors of teenagers, since they are of critical importance to the long-term health and well-being of our state. Because of that, the health of adolescents will be the focus of today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at some of the health issues facing adolescents in our state. While reproductive health will be a particular focus, we'll also be looking at the broader health issues facing teens, like mental health, violence, and drug use. Joining me in this discussion today are Leah Hebert, Executive Director of the West Suburban Teen Clinic, and Theresa Evans-Ross, Director of the Eliminating Health Disparities Initiative REACH program at the Annex Teen Clinic. These clinics provide confidential health services to teens in the western part of the Twin Cities metro area. Theresa, welcome, and Leah, welcome to this program. I want to talk a little bit about West Suburban Teen Clinic and the Annex Teen Clinic because like I said, they focus on teen health, particularly reproductive health. When did these clinics get started? When did West Suburban get started?
Well, next year will be our 40th anniversary. And we all kind of got started the same year because I think the Annex celebrated their 40th anniversary this year. So it was right around the time people were noticing, an increase in teen pregnancy. Some things were happening legislatively, and some concerned citizens, I think, across the metro area started these types of clinics.
Theresa, why not just have regular clinics, the pediatric clinics, the family medicine clinics? Why don't those, meet the needs of teens?
Well, I think, and I will say that, yes, this is the 40th year for the Annex Teen Clinic, that we've been a leader in teen reproductive health. We provide clinical services, counseling, education in the community, and referral services. I think this suits us well. We have a teen-friendly clinic. Teens like to come. This is where they respond well, and the setup is such that teens understand that we're there to care and give them the care that they need around teen pregnancy and STIs.
Now, is confidentiality a big issue with teens, and is that why you have separate clinics from where the parents might be getting health care?
I think it is, and we have two clinics, one in Hopkins and one in Excelsior, and some services for teens are confidential and some are not. So in Minnesota, reproductive health care is confidential for teens, but basic health care, which we provide at our clinics as well, and mental health care is not confidential. So parents have to consent for things like strep tests or sports physicals, that type of thing. But teens really need a place of their own that they feel comfortable in, and they don't feel comfortable sitting next to little kids at a pediatrician's office, and they often don't feel comfortable sitting next to adults at their parents' clinic. So we really, I think, clinics like both of ours, work on our decor, our language, who serves them. Everything is geared towards adolescent needs.
So the music in your waiting room?
Absolutely.
Exactly. And we also provide low-cost care, and it's non-judgmental. That's very important. We don't look at why they became sexually active. We're there to serve them and to help prevent teen pregnancies. And this is important that they realize that we're not judging you. We're here to hear you and serve you.
Are there other clinics like West Suburban and Annex in the metro area?
Now there's only one other clinic that's really specific for adolescents, and that's in St. Paul, face-to-face clinic in St. Paul.
Because there had been more? But
there had been one other clinic, TAMS, Teenage Medical Services, that was run by Children's Hospital, and that just recently, at least temporarily closed. I'm not sure what the future of that clinic is.
So how are these clinics funded? How do you maintain? Because teens don't have a lot of money, and we've usually had a fee-for-service kind of schedule. And if you can't bill insurance because of confidentiality, how does the annex keep going?
Well, we have grants that we receive. As you know, my program is funded through the Eliminating Health Disparities Initiative at the Office of Minority and Multicultural Health, Minnesota Department of Health. We also have grants from the United Way, and we have the Family Planning grant that we receive from the state. So these are ways that young people, if they are not able to pay for the service, at least we have a way that we can give them low-cost service or free service by having these funding grants.
And of course, we all fundraise.
Yeah.
A lot.
Oh, definitely that.
A lot. And you know, we accept private insurance and public insurance. So there are some teens who choose to use those types of insurances.
Right.
So.
Well, I'm going to look at some of the issues, and I've got a chart here that shows the nationally what's going on with rates of teen pregnancy, teen birth rates, teen pregnancy, and abortion rates. And if they'll show on the slide here that the top line is teen birth rates, the middle line is teen pregnancy rates, and the bottom line is teen abortion rates. And since the early 90s, these rates have really been going down, and then they've started to plateau. Tell us a little bit about what was happening during this time. Why did we have such good success from the 90s until the mid to late 2000s, and then it's 2000s, and then it had started to plateau? Theresa?
Well, I believe one of the reasons why it's declined is because of education and because teens began to use condoms. The education around condom use was very strong, and then they started using condoms more often. I also believe that because there were the long-term birth control programming, excuse me.
Yeah, contraceptives.
Contraceptives, sorry. That they were beginning to use that, like the Depo, Provera, and so they were using those, and so they were getting more education around it, and then we saw the decline. But that trend is changing, as you know, among African American youth. That decline was there, but it's also rising now, and it's still disproportionately there. So.
I think we know that our programs have been successful or more successful with young people who are white, and the programs haven't been as targeted and as successful with kids of color, and so we're seeing that impact our pregnancy rates. And we're also perhaps seeing some of the impact of abstinence-only education, where multiple organizations have studied it and decided that many of the programs that have been so heavily funded aren't working and aren't really truly making long-term impact on the behaviors of young people. So I think we need a lot more study about these things.
Well, I know that in the 90s there was a big push for comprehensive sex education, and then in the 2000s it really got more on an abstinence only. And I know that some of the abstinence only programs do work, but generally many they're not as effective as across the board. So you're seeing this as one of the reasons comprehensive sex education has really been helpful, and if you take just a single approach, not quite as effective?
Right. I think we know that we need to talk about abstinence and we need to talk about contraception. That when we're talking about abstinence until marriage and we're using some of the tactics in some of these abstinence programs, they may temporarily stop behaviors, but long term, when young kids or young people decide to have sex, they aren't using contraception because they haven't been educated about its effectiveness. So the choices that they make later, aren't choosing the safest way to go. So that's why it's important to talk about abstinence, which we do in all of our education programs, but also talk about contraception.
Okay. Well, I've got a few slides that I want to go through, but we're going to take a little break first. And when we come back, I want to look at some of the rates of sexual activity and also the rates of condom use and contraceptive use among teens nationally, but also in Minnesota. So we'll come back right after this message.
You don't have to be perfect to be a perfect parent, because kids in foster care don't need perfection. They need you.
Welcome back. We're talking about adolescent health and adolescent pregnancy with Leah Hebert, Executive Director of the West Suburban Teen Clinic, and Theresa Evans-Ross, Director of the REACH program at the Annex Teen Clinic. I want to go through some data here, some slides. Public health is all about data. So I want to show a slide about nationally about 15 to 19-year-olds who have had sexual intercourse. And you can see both males and females from 1998, which is on the left. There were fairly high rates of sexual intercourse. And then it's been steadily going down to, in the 2006 to 2010 for both males and females. We've seen a good drop in sexual intercourse. And then the next slide shows basically the same thing with just 2 years from 2007 to 2010 from the Minnesota Student Survey, which shows that ninth graders are increasing sexual intercourse, and then 12th graders increasing sexual intercourse. Tell us what's going on with nationally, rates are going down, and then in the last 3 years in Minnesota, rates are going up.
Well, I think it would be great if we could really, if we knew absolutely the answer to that. So I think we can speculate a lot of different things. We're certainly talking about it more on a national level. There's more dialogue. We're doing more education. Kids are getting more education around it with their parents. They're being encouraged to talk about it. We live in a more sexualized culture. In Minnesota, I think that, again, it reflects some of the health disparities that we've been talking about, that some of the education that we've done here has not had the same impact on communities of color. Because when you really parse these apart, we're seeing that there's more disparities in communities of color than there is in white communities.
Mm-hmm. And in Minnesota and in other states as well, there's not a mandated program. Mm-hmm. Schools are still teaching abstinence only, or they are deciding what comprehensive sex education they're going to do. So I think of that piece, parents aren't talking. Young people, there's peer pressure to be sexually active or to pretend that you are. And so a lot of things are happening. So we are speculating. And hopefully we can stop speculating and get to the root and start working on this problem.
I also think none of these studies are addressing oral sex. And when we get to the slide about sexually transmitted infections, I assume that we'll talk about that a little bit, but they're only asking about intercourse, and I think it doesn't help us talk about the problems that kids are facing. They're getting the message that they shouldn't engage in intercourse because there's this kind of a result, but I'm not sure that we're getting them the message that they shouldn't engage in other forms of sexual activity.
Yes. So sexual activity is much broader than just penile vaginal sex. All right, I got a couple more slides that I want to go through fairly quickly, and it's about contraceptive use, and one is on the national rates, intercourse, which shows contraceptive use at last intercourse, and you can again see as the years gone by nationally, it has gone up much more dramatically in all forms of contraceptive use. And then if you look at the next slide, which shows again the rates of use of contraceptives or condoms in Minnesota 9th graders and 12th graders over the last 3 years, the use of condoms has gone down. Again, what's going on with this? Why is Minnesota standing out as a little different than national? Theresa?
That's really a big question. I do hear from young African American women who are sexually active that there's a problem negotiating the use of condoms with their partners. There's that trust and that infidelity piece that goes with that. So there are many reasons. We've discussed a lot of them in sessions that I've had, but the rates, I guess we're just trying to figure this piece out. Why aren't they going down?
Yeah, is Minnesota different? Are Minnesota teens different? I can't imagine them.
I can't imagine it, but...
Well, I think it's one of the reasons why Minnesota just received a large grant from the federal government to implement some of and both of our clinics are participating in it. Hennepin County received a large grant to be able to work specifically on increasing condom use in adolescents. So we're running, both of us are running different programs that are evidence-based programs that have been proven to increase condom use in our clinics. So kids are coming in and they're getting tons of information about condoms and why they're effective, and then we're following up with them really closely over the next year to increase their condom use.
Are the educational programs in the schools different in Minnesota? Are they more restrictive than
many other places? Yes, they are. I am doing a program in a school now that is allowing me to do condom demonstrations, which is great because it's always that piece you hear from young people saying the condom broke. Well, if you use it consistently and correctly, it will not break. So we want to make sure they understand that and demonstrate to them how that's done if they are sexually active. We're not promoting being sexually active, but we want to get that information out. And we hope that parents will understand that and start talking to their sexually active young people, or if they at some point will become sexually active.
And I think you mentioned it before. There, you know, our education program is in 21 different school districts, talking to kids, and 21 different school districts have 21 different values and different policies around what we can talk about around sexual activity in their school districts. In Minnesota, the state doesn't have a law or any kind of a mandate that you have to talk about any particular subject except for STIs and HIV. So each school district gets to decide what they talk about, and unfortunately, school districts are in tough positions where they're responding to a vocal minority who are speaking that they would prefer abstinence or no discussion of condoms in their classrooms, and that's really tough.
All right, now I want to go to another slide where I want to spend a little bit of time on, and this, you know, again points out the differences in Minnesota versus the rest of the country. And this is the slide that really looks at birth rates by race. And if you can see, except for whites, which are on the far left, the Minnesota birth rates among white individual teenagers is lower than national, but every other racial group, the rates of teen births are higher, particularly in American Indians and Asian Pacific Islanders, but across the board. You know, Theresa, that you work in the REACH program, which really is focusing on a lot of the minority communities. What's going on here?
I think this shows an inequity in the health care. Most of the people, even access to health care, most of the people that I'm working with in the African American community in North Minneapolis have no health insurance, or they lack access to getting good health care. So that's, I think, contributes to poverty, all the number of disparities, unemployment, and even education. This all contributes to the disparities across the board, where there are high rates of unintended pregnancies and STDs and HIV. So we need to look at that. We need to look at culturally specific health care that respects the culture, the behaviors, and how to work with people of color in delivering good health care. We tend to see that people of color who come, in particular African Americans, who go into the clinics and get tested already have had the STI or the HIV longer than before they, the care that they need to have. So that means that they have been infected for a while and more likely will acquire AIDS quicker because they haven't been receiving the health care they needed. So we're looking at culturally competent case management services and referral services as well, and how that's delivered to people of color.
Leah, are teen clinics more attuned to the racial and ethnic diversity in our community or not?
I don't know that, not necessarily. I mean, we'd like to think we are, and I think we examine it a little bit more internally and try and work on it. I think the thing we know about adolescents is that you have to go where they are and talk to them the way they need to be talked to. And so it's very specific. The same thing can be said about culturally specific programs. Are we truly talking to kids in a language they understand, giving them services that are tailored to them, and speaking, to them in ways that resonate in their lives? And so these are questions that we need to ask ourselves about adolescent health care, but they're also questions we need to ask our programs about culturally specific care.
As you mentioned earlier, there aren't that many teen clinics around, so maybe we need to develop more in various parts of our community. Yeah. All right, I want to talk about some of the other health issues that are facing adolescents, but we need to take another little break. And I'll be back right after this message.
I am folding the pants. The pants are long. Do they go on my head? Do they? Do the pants go on my head? No. They go on.
Everyday moments can become teaching moments because learning starts long before school does. Give your child the start they need at bornlearning.org.
Welcome back. We're talking about adolescent health with Leah Hebert, Executive Director of the West Suburban Teen Clinic, and Theresa Evans-Ross, Director of the REACH program at the Annex Teen Clinic. I have one more slide that I want to put on, and it's a slide that's pretty dramatic. It shows the birth rates of the United States compared to every other country or industrialized country, and it points out the fact that the bottom line, which is the United States, we're, double or triple or quadruple the birth rates of most other countries. Not just by a little bit. Obviously this is a huge difference. What's going on in our society compared to the other societies across the world? Leah?
Well, I think we all have probably theories about that. I'm not sure that we know exactly, but I think one thing, again, is about education. We're sending a message, a highly sexualized message in this society, yet, a lot of the programs that we've been using have been abstinence-based programs, so kids are getting a real double message.
Which means, what, advertising and thing really talks about, we sell products by sex?
Yeah, with sex. We're talking about sex all the time. Kids are watching sex on, Gossip Girls on TV and in the books that they read, and then in school, we're not allowing them to ask the kind of questions where they're getting the best information that they possibly can in order to prevent these types of behaviors. So I think that when you're sending that kind of a sexualized message, we absolutely need to do a better job of talking about prevention at the same time and why choices might not be the best thing for them. And a lot of these countries have much more frank conversations about sex and about prevention than we do.
That's true.
Theresa, did they make contraceptives more available too in other countries? I
think in other countries they do. They talk it. We show it on TVs as you explained, but we don't talk it the way that other countries do. We don't accept the fact that young people, it's a normal process of transitioning into adolescence, that they're going to have these feelings of sexuality or sexual feelings. We don't accept that. We kind of in denial about the transitional periods that young people go through, even though we've, as adults, have gone through them ourselves. Those countries tend to talk more, they educate more, they don't restrict contraceptives if young people are sexually active. We have an issue with this for some reason, and once we get past all of this purity or sainthood or denial about sexuality and sexual feelings and let young people grow and learn, then I think we are on the way to helping them understand how to go about making good choices and decisions around if you're going to be sexually active. So the United States is lower. France is 4 times higher in reducing teen pregnancy than the United States, and Canada is at least twice as high in that reduction. So where are we? If we are the leaders in so many other things, why are we creating inequalities or injustices and racism and health disparities, and when we can rise above all of this and be the leaders in that particular piece as well?
Well, I guess I have to ask the question I forgot to ask early on. I should have asked is, so what's the problem with teen pregnancy? Why is it such a problem? Not the numbers, but why? What happens with teens when they get pregnant?
We know that their life changes in so many ways. I actually was a teen mom at 17, so I can speak to how difficult that is. But I had tons of resources. A lot of teens don't have those kind of resources. They're dropping out of school. They're not finishing college. They don't continue their education. We know that their kids are at much higher risk for early births and sicknesses, and not finishing high school themselves and repeating the same patterns over and over again. So none of these things are are creating the kind of society that we want to create. So, and
that pattern for teen pregnancy moves into the next generation. Those children of parents who had teens at an early age are also having pregnancies at early ages. The impact on the community is just great, very high. There's already poverty in the community that I'm working in, and unemployment. So you have young people who have young babies, and they're unemployed. And so this just continues and continues, and the cycle doesn't seem to get broken.
Yeah. So it has
easily.
problems with economics, education, health, all of these issues. We're getting near the end of our time. It's going faster than I thought. So, you know, Leah, what kind of messages would you like to depart to parents who might be watching this program?
Talk to your kids. I mean, we know without a doubt that even though they act like they're not listening, and I know mine act that way too, but they are. They're listening to their parents, and their parents, what they say is extremely important in the choices that they make. So talk to your young people.
All right. And Theresa, for the people of color who might be watching, minority, particularly teens, what kind of message do you
I
want
say
to-
the same thing, talk, but also get educated yourself. We have programs where we educate parents around sexuality and how to communicate with your teenager, your young child appropriately around sexuality issues and teen pregnancy and sex and all of that. So get educated. That's the main thing.
All right. Good. Well, you've done a good job of educating me, and I hope the general audience. So thanks for being with us.
Thank you.
And
very
good luck
much.
on your efforts in the Minneapolis, Twin Cities area. Let's hope we get more programs like yours up and running.
Thank you.
And I'll be back with a closing comment right after this message.
To be a good father is the most important job in a man's life, but it doesn't have to be hard. Play catch, go to a park or visit a zoo. Help your child with their homework. Sit down together for dinner. Ask them how their day was. Things get busy, and sometimes we all fall short. But the smallest moments can have the biggest impact on a child's life. Take time to be a dad today.
Author Wendell Berry wrote that a bad solution solves for a single purpose or goal, and in doing so, often creates bigger problems in the larger society. Good solutions, he claims, recognize that they are part of a larger whole. They solve more than one problem and don't create new problems. Attempts to reduce adolescent pregnancy rates often fall into the bad solution category because they only focus on one aspect of adolescent life, and in doing so, often lead to a skewed picture of adolescence, one that highlights only the negative outcomes like poverty, lack of education, and poor health. We need to step back and take a broader view of adolescent life, one that shows us the complexity of their lives and how all parts of their world interconnect. This view will also give us a better insight into their dreams and hopes for the future. A broader contextual perspective will quickly show us that adolescence isn't just a period of life that we all have to suffer through. Rather, it'll show us that it is a critical and exciting time of maturation, growth, learning, and development that is preparing adolescents for their future adult roles in our society. That broader contextual perspective will probably also give us better insights into how to more comprehensively address some of the individual problems, like pregnancy, that adolescents face. So let's not just focus on the problems of adolescence. Let's focus on adolescents as whole beings who are an integral and important part of our larger society. In doing that, we'll have a better chance of discovering some of the good solutions that Wendell Berry writes about. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.